This is Kane. He's a black lab that presented to WSU with a FCE or spinal lesion, and he is paralyzed in the back end. And what we're going to demonstrate today is how to do passive range of motion. And when we do passive range of motion, we always want to start at the toes. And so it's easier if your dog will lay in lateral recumbency, and so we'll have somebody assist us here with that. Down. And so when they're in lateral recumbency, you can give them a little belly rub, kind of get them comfortable, and then just move down to their toes. And you'll start with their individual toes, moving it back and forth. And you'll do each toe 5 to 10 times, and then you'll finish up by doing the toes all together. So bringing them up forward and then bringing them down. And again, you'll want to repeat this 5 to 10 times. Then you'll move up to his tarsus or his hock, and you'll flex this, and you'll put your one hand up here above his knee, and then flex this so you're at a 90-degree angle, and then you'll want to bring it all the way back out. And you'll do this in a nice, slow, rhythmic motion, and repeat 10 times. Once you finish that, then you'll move up to his knee or his stifle, and then you'll keep your lower hand in the same spot, your upper hand here, bring his leg together, and so his hock will come up here to his hamstrings, and then when you bring the stifle or his knee forward towards the front of his body, and then bring it back, and repeat this 5 to 10 times. If you feel any resistance, you can hold this stretch. So hold this for 10 to 30 seconds, depending upon how much resistance you have, and then bring it back. Then we'll move up to his hip. So his hip will come forward here, so his knee is here by his ribs. So his ribs are right here, his knee's right here. We're flexing this joint right up here, his hip joint, as in flexion, and then we'll bring it back in extension. And you'll want to keep his back kind of straight, so he's like this, and have a good, nice stretch here. So then when you finish the hind legs, then you can move up to the front leg, and we'll start again down at the toes, so moving each toe individually. And then doing toe extension and toe flexion, and repeating this 5 to 10 times like we did in the hind legs. Then you move up to his wrists, and the wrist will come his foot will be able to come all the way here to his forearm, and then extend out. Once you finish the wrist, then you can move up to his elbow. And when you do the elbow, you'll want to have this as a straight line, so you got a nice kind of 90-degree angle here. And then extend this out, so you'll get full extension here like this. Then you're 90 and about 180. And this is a really good exercise for dogs that have elbow dysplasia. Then we'll move it to the shoulder, so his shoulder's right here. And with his shoulder, we'll bring his elbow up here to his rib cage, and this will be flexing this joint here. And then when we get done, we'll bring it forward, and it'll kind of come across his face. Again, each of these are done 10 times, and then you can hold them for 30 seconds if you need to stretch.